So it has been called a revolutionary public sector initiative. It's been called an Indigenous policy success story. Starting with the nitty-gritty, could you just begin by describing what is Whānau Ora and in practice, how does it work?
Okay, so one of the things I really want to get across in this time that we have is the complexity around talking about Whānau Ora as in the policy space, because depending on how you conceive of it, it's a philosophy, it's a model of practice, it's an outcome, and there is a thing called the Whānau Ora policy, which has, since its inception or since it has become this thing within our public policy sector, has morphed and has evolved. So what we think of as being the Whānau Ora policy back in 2010 is very different 10 years later. And when we first think about Whānau Ora, actually, from a health perspective, those who know the health sector will know that Whānau Ora was first mentioned in He Korowai Oranga, the Ministry of Health strategic document back in 2001. So actually we've had 20 years of Whānau Ora being on the public policy landscape. So it is important that we distinguish what we're talking about when we talk about Whānau Ora. So in phase one, Whānau Ora as a policy had a number of characteristics. We had capacity building of health providers. We had the Whānau Innovation, Integration and Engagement Initiative, which was called the WE Initiative. We had the idea of integrated contracting became apparent. Whānau Ora Navigators entered the scene, and there was the idea that Whānau Ora as a policy would be overseen by a series of regional collectives. And so that was phase one. We moved to phase two, and some of those elements from phase one didn't carry across for whatever reason. But phase two, I guess the thing that people will most be familiar with is the Whānau Ora commissioning agencies. We had the introduction of the Whānau Ora Partnership Group. It was one of the key platforms, I guess, for potentially embedding Whānau Ora within the wider public policy. The potential, you talk about potential and opportunity, that Whānau Ora Partnership Group really had the potential to make significant change. And why I say that is because it comprised 6 ministers of the Crown, 6 iwi leaders who met at a table as equals. A rangatira ki te rangatira relationship, which we haven't seen anywhere else in social policy, and I don't believe we've seen anywhere else in other public policy either. And that was a group that was at least funded to undertake a work program which was jointly managed, jointly agreed to. Also in phase two, and I guess one of the outcomes of that Whānau Ora Partnership Group was the Whānau Ora Outcomes Framework, agreeing that these are the outcomes that we wish to see across social services, social policy and beyond. And so that was we've never had a document like that before or since, to my knowledge. Whānau Ora today, under a Labour government, again, has evolved and changed. We still see the commissioning agencies. They are still in existence. However, I would argue that some of the principles and the underlying values which were first espoused within the task force report 10 years ago, you wouldn't necessarily see those today in today's Whānau Ora landscape. So we may have lost, I think, some of the intent in a way in which the policy has kind of taken over and evolved and moved and morphed.
In terms of the navigators, could you just briefly describe the role of the navigators within Whānau Ora?
So a navigator walks alongside a whānau to assist them to identify what it is that they need to be well, to be healthy, to be to flourish as whānau, and then advocates and brings resource together for that whānau. So one of the things I should have said are some of those principles that underlie the philosophy, and those include the ideas that Whānau Ora should at all times be whānau-centric, whānau-driven, about whānau self-determination. So the idea that it's whānau that lead their own or make their own decisions about what they need, and then the service provider is there to support them to do that, which is kind of flips that idea that we have about service provision. So Whānau Ora in its if it were working as it should, would work intersectorally. It would work across departments. At the moment, we have a system where our departments, they get their vote. It might be vote health. They work in their health silo, and Whānau Ora cuts across all of that. For it to work properly, you have to have this idea of integrated contracting. You can't simply have a well child contract and a quit smoking contract and a primary care contract for the provider to manage and try and deliver on a Whānau Ora outcome. So breaking down the silos at a ministerial level, at a departmental level, at an agency level in terms of implementation on the ground, that's the space that the Māori providers or the Whānau Ora entities are operating in and trying to manage. So because that was the intent, it hasn't happened. And so Whānau Ora entities are still, for the most part, trying to manage how to deliver a Whānau Ora outcome, which might be a flourishing whānau, with a multiplicity of contracts, a multiplicity of funding streams, a multiplicity of accountability and monitoring arrangements.
The Whānau Ora approach could be used to significantly transform social policy, but it has faced challenges and barriers. So perhaps would you just like to describe some of those challenges and barriers in terms of Whānau Ora as a policy, in terms of its development, in terms of its implementation, and how that has changed the form that Whānau Ora policy has taken?
What was envisaged with the original policy was that Whānau Ora would be whānau driven and whānau centred. I think I've talked about that we would have an active and responsive government, meaning active and responsive to the needs of whānau, that we would have whānau, iwi hapu, so collective leadership, that there's an absolute understanding that whānau are and should be self-determining, that the answers for whānau lie within whānau themselves, and that the role of the provider or the service is to bring those aspirations and visions and dreams that whānau have for themselves to the fore and help them achieve that. It acknowledges the strengths that are within whānau. So it's we're again turning that deficit framework on its head, understanding that, no matter how pohara or how broken a whānau may appear, they will have some strengths in and of themselves, and to bring those to the fore. And as I said, it's aspirational, it's intersectoral, it requires intersectoral delivery, and it has an intergenerational focus, which is, so if I talk about those things, we can, and we understand social policy, we can see where some of the barriers and the challenges might be. And our 3-year policy cycle, which is, driven by electoral cycles, doesn't work when you're talking about long-term intergenerational outcomes. And I say intergenerational because, it's been 180 years of colonisation that we are trying to overturn, and to expect to do that within a 3-year cycle, a 10-year cycle, or even now 20 years of Whānau Ora, we need time to undo the 180 years of colonisation. The structure of the public sector that we have now is anathema to Whānau Ora being achieved, really. We need to, for it to work in the way that it was intended, we actually need to dismantle some of those structures, some of those systems and some of those processes that actually prevent a Whānau Ora philosophy or a Whānau Ora outcome or a Whānau Ora way of working. And really what we're seeing from our Māori NGO sector is that they're working in spite of those barriers and those structures still being there. We've had both a report from the Auditor General and a report from the Productivity Commission, and they talked about the intense monitoring and scrutiny over the Whānau Ora policy. And for this to work, I'm not saying that we just, dish out a whole lot of money and walk away, but there are ways I think that we can do monitoring and oversight that takes a lighter touch. The potential of Whānau Ora has yet to be realised. I still think that for Māori, for Māori communities, for Māori whānau, it is still the policy or the policy approach that will work best for us. Yeah. Because it comes from us. It is based on our values. And the difficulty really is actually how we make an authentic treaty partnership in this country. Mm. And so all the power, all the pūtea, all the funding, all the control currently sits with Crown. And if we've learnt nothing else from COVID-19, we've learnt that Māori communities, our hapu and iwi leaders, know what's best for them and are able to mobilise and are able to come up with the solutions for them. If you walk alongside whānau and if you are there to support whānau and allow whānau to determine their own destiny, actually magical things, amazing things can happen. And that is all for the benefit of this country as a whole.